Hi everyone, I'm Rob Stokes. I'm a senior application developer at Narus Health. At Narus Health, we are a technology-enabled care management company serving consumers, payers, and providers. We're headquartered in Nashville, Tennessee. We look to serve the top 1 to 5% sickest people. We're domain-focused patient care covering both clinical and non-clinical issues. And we have a multi-touch proprietary platform including mobile video and patient support center. We have fixed and contingent-based pricing models. So thus far in the journey, the small company, we've built 2 main pieces of technology. First is Compassion. Compassion is our nurse-facing care support system. It facilitates the generation of a personalized care plan for every single patient. It provides document storage, categorization, searching. It also provides a means for secure messaging with patients, caregivers, and their family members. The second piece of technology we've built that we call Empower. This is a mobile application designed to be used by the patient, caregiver, and family members. It allows patients to share and export their entire patient record. It allows quick access to important documents such as advanced directives or educational content. It also allows them to secure message back and forth with the nurses at Narus Health. When we decided to build these technology platforms, we made a decision early on to use FHIR and build it from the ground up on top of it. So we made a decision to use AidBox as our back-end database system and FHIR engine. And then there's 4 other primary technologies that we use in AidBox that have made us successful thus far: documents, messaging, and terminology. The core of our patient record that we use to pull and store information from both our mobile platform and our Compassion platform is the HL7 FHIR REST API. This has accelerated our development process by preventing us from having to build out a database schema, model, managing stored procedures, and allows us to directly access it from our back-end API using RESTful calls. Second major feature that we use with AidBox is the secure document storage. It allows us to store both structured and unstructured documents. We use this, our use cases include storing copies of advanced directives, encounter reports, messaging attachments, educational documents, to name a few. Next is the real-time polling API built into the platform. This allows the patients, caregivers, family members, and then the nurses all to have group conversations, sharing documents and conversation with each other about the ongoing patient case. And third is the terminology service. So this allows us quick lookups, categorization, and documentation of most of the major categories, including ICD-10, NPI, and RX norm. So next, let's walk through some of the features with Empower. So Empower is actually out on the App Store. If you are enrolled in Narus's care, then you'll get sent an invitation which will take you through the enrollment process and then grant you access to your patient record. The first major feature we'd like to go through is we call My Data. So this is basically a comprehensive list of the majority of the FHIR resources that we have for the patient on file. So some examples are medications, your care encounters and the documents generated during each encounter, the documents we've stored for you, your allergies, immunizations, insurance information, and important phone numbers, and then your personalized care plan that we've generated for you during our assessment process. The patient in the top right, you'll see the share icon. They can quickly click that and it will generate an email with all of the documents attached and all the information so they can quickly send it to a friend, family member, provider, whoever they like. Next is medications. So during the assessment process, we collect and document all the medications that the patient's taking. This includes both prescription and over-the-counter. The patient can actually record, this version of the prototype doesn't have it, but the actual app has it where you can actually record when you've taken your medication so you can track your compliance. It also gives you important information like frequency, the prescriber, the start end date, and the indication for each drug. Next is our symptom reporting functionality. So this allows patients and caregivers to report symptoms real-time to Narus using their app. This sends notifications to the care team. The symptoms we have in this survey are based off the Edmonton System Assessment Scale. This is important to us based on the high comorbidity type of patient we serve. These types of symptoms are known to correlate highly with high utilization and low quality of life. So we like the patient to be able to send these to us on demand whenever they need to, so we can get ahead of a problem before it turns into a major issue. And if the patients are not sending us their symptoms every 3 days, then we'll actually send them a notification that will direct them into the app where they can then submit their symptoms. Next is secure messaging. So there's two components to this. There's the compassion portion, which we'll go through, and then this is the patient, family, and caregiver portion. So this allows group messaging. It's secure. It's real time. It's that iPhone, iMessage type of back and forth that's very quick and responsive. So group messaging with friends and family members. So that really keeps the whole family in the loop of what's going on. So these conversations can include, husband, wife, child, and then the nurse care manager at Narus. The patient from their mobile device can actually enter a phone number and email for anybody they would like to invite to the app, and that will give them access to participate in these messages. So that can actually happen without Narus having to actually invite them directly. It also supports multimedia messaging. So this is critical for snapping quick photos of a symptom or a rash, or if you have a PDF document that you've signed and you'd like to return, or we have one that we'd like to send you, we can quickly transmit those back and forth. Finally is the care team portion. So this is basically the comprehensive list of contacts that the patient needs for their care. You have quick links you can see to the side there to either place calls, or if they're part of the Narus team, you can actually go ahead and create a message and start messaging them directly in the app. All right, so now I'd like to go in and show this real time. So this is the landing dashboard. I'm the nurse Jane Smith, and this is the homepage for the Compassion platform. So the few things you'll see immediately. Let me toggle quickly to the entire patient population. First, in the top left, we have reports. So we talked about in the mobile application, we can actually submit symptoms. Well, these land right here so that someone can pick them up and take care of those immediately. The next pane to the right, you'll see those are the unread messages that I haven't seen yet. Down below this, we have our patient population, and then we have at the bottom our to-do list. So the to-do lists are generated based on our personalized care plan, which we call IGAO. So it has issues, goals, and then actions and outcomes. So all the actions that are outstanding that are overdue or due in the next 7 days, I'll see at the bottom that we can then pick up and work. So next, my partner Ryan Harper is here, and so he is going to participate with us today as Alex James. Let's see what he has to say. And so he's doing this on his phone right back there at this moment. All right. Is that all you got? So, let's see. So that's it. So next we'll come back to the patient folder and go look at Alex James' chart. So Ryan, you want to go ahead and push some symptoms to us, see what happens? So I'll quickly run through what happens or what we've got here. So again, we also call it our patient banner. So basic demographic information, age, last for the social, for unique identification. We've got our ICD-10 driven primary diagnosis and comorbidities, residence type, their primary insurance carrier, and their primary care physician. So next closely we can go back and access our messages. Let's see here, he sent us a picture. Oh, there we are. And then we can quickly see that he has an allergy. So he's got a medication allergy to penicillin. So next, we've got our list of open issues for Alex. Down below, we have our list of documents that he also has access to on his mobile application. So a copy of his advance directive, copy of his insurance card, whatever information we have, a list of his active medications, and then we generate 3 kinds of reports for every single encounter with a patient. So first is our encounter summary, which is basically a delta on the patient record. So everything that changed during this encounter, the signature and the narrative. And then we've got our patient summary. This is every single data element that we've got on the patient. And then finally is our care plan report. So this is intended to be shared with friends, family, and providers of what the plan is going on with the patient. All these documents can quickly and securely be sent via HIPAA-compliant fax to any provider on the patient record, or we can use secure encrypted email. And we track an audit log of the transmission from who and when every single document went to, so we can keep track of all of that stuff. All right, so that's it for the demo. Oh, Ryan, did you get us? There we go. So Ryan, it looks like he has some issues with anxiety. So you can see just a moment ago, and shortness of breath. So you can see here, he pushed it from the mobile. I see it now on his chart. And then I also see that we've actually added 2 issues to his care plan automatically that are unassigned that need to be picked up with a status of new. That way we know that we need to pick it up and do something about it. All right, and so finally we have a little bit of an announcement to make. So beginning on March 15th, we're going to be offering our services direct to individuals. So we're going to provide 24/7 access to care managers, nurses, and social workers and physicians. We'll provide always-on access to your care team via secure text, messaging, video conferencing, and telephone. We'll generate a personalized care plan that is always accessible to you and your caregivers. We'll help coordinate your care with doctors and treatments. We'll provide a centralized location of important health documents such as advance directives and wills. We'll help you understand your health benefits and bills, and we'll provide you with educational materials specific to your situation. So if you have a family or loved one that could use this type of service, send us an email at info@narushealth.com or come find me afterwards. Thank you.